dear friends, I am Dr. Amit Kothari. I am a consultant physician, diabetologist and an intensivist. Currently practicing at Samarth Hospital, Talegaon, Dabade. It's located in Pune city. Today, shortly I want to introduce some information regarding the basics or understanding of the hypertension. Friends, as we all know, hypertension is the leading cause of death and disability all over the world. Now, what does exactly the word means by high blood pressure or an hypertension? Normally, in a normal state, in an individual, whenever the heart beats, it pumps blood into the blood vessels. Now, this blood, when flowing through the blood vessels, has some pressure over the walls of the blood vessels. This pressure which is created is called as an blood pressure. Now, whenever few of the patients who have persistently high blood pressure, which is rather higher than the normal, it is called as an hypertension. Now, what are the major risk factors causing this hypertension? First, mainly I would like to mention regarding the non-modifiable risk factors. These are like age. As we age, our arteries, the blood vessels in our heart and the body get stiffen as we age first. Secondly, there are few of the risk factors like genetics are involved, in which our family members have got a history of an hypertension per se causing hypertension into the further generations. So, these two are the non-modifiable risk factors for hypertension. Second most commonly and the most important factor is the unhealthy lifestyle in the form of lack of exercise, obesity, eating of outside or street foods which is highly processed, and third is lack of vegetables and fresh fruits in our diet. Now, all this leads to increase in the risk factors for the development of the hypertension. So, now coming to the basic definition of hypertension, like blood pressure of around 120/80 is considered as a normal blood pressure. Whenever the levels of this blood pressure goes are more than 140/90, it leads to the term called as hypertension. So, it is basically consists of two types, it's a systolic and it's a diastolic. So, what the number which is first, it comes usually as a systolic, in which it's the pressure which is built up into the vessels of the blood vessel when the heart is contracting, and diastolic stands for the blood pressure in the heart when the heart is at a relaxation phase. So, these two are the major factors considering the blood pressure. Now, coming to how to prevent this epidemic of the blood pressures. Firstly, I would like to recommend everyone, each of one of us, that we should have a healthy lifestyle. This healthy lifestyle will include at least a daily exercise of aerobic activities, around workout of around 30 minutes per day, at least 4 to 5 times a day a week. Secondly, we should include most of the fresh vegetables and fruits in our diet. Thirdly, cut down our salt intake. Now, salt is considered to be one of the biggest risk factors for our Indian scenario. So, cut down our salt intake will lead to dramatic decrease in the blood pressures. Fourth is our meditation or stress management. So, this is well known fact that stress leads to an increase in the blood pressure levels of each and every individual. So, we should practice some good practices like yoga or meditation, so that the stress can be managed correctly. And lastly but not the least, we should be always active. We should try to avoid all the fast foods and processed foods which contains high amount of salt in it. Lastly, the most important point is regarding the adherence to the medicines. Now, few of the patients who are not able to control the blood pressure because after following all these lifestyle modifications, dietary changes, but still the patients will have, there are few patients still who require medicines. So, I would highly recommend for these patients that they should be strictly adherent to their medicines. Like we all know, hypertension is a silent killer. So, initially there will be no symptoms of hypertension as such, but persistent long-standing hypertension in our body will always have an adverse effects on our multiple systems in form of like a stroke, heart attacks or paralysis. So, adherence to the medications is one of the last and most important point which should be thoroughly followed. So, to conclude, as an hypertension is always better to be prevented than taking the tablets. Therefore, signing off, thank you so much. I am Dr. Amit Kothari, currently practicing in Talegaon, Pune. Thank you so much.